Normally, the patient comes to see me with their x-rays and expecting me to sort it out, right? But nonetheless, they usually comes to see me only when they have a disturbance in the quality of life, all right? Then naturally they would have all this pain for many months, but nonetheless, only when they have this disturbance in their quality of life, such as having difficulty while sleeping, the problem which the pain in the shoulder which occurs at night, and later after a few hours of sleep they are kept awake by the pain itself, and that's when they come and see me. Right. Absolutely not. The evaluation of the shoulder is based on the problem, and most of the time the treatment of these problems, such as the shoulder pain, can be treated by non-surgical means. All right. The conditions of the shoulder pain, such as acromioclavicular joint dislocation, frozen shoulder, rotator cuff tears, these can all be treated by non-surgical means in early phase of the treatment. And it also sometimes involves the activity modification of the patient, where the lifestyle needs to be changed or corrected to basically to cure or to improve the patient's condition. And this all in all may have already avoided the needs to undergo surgery for the patient. The indications for surgery are once the problem that can be solved only by surgery. So after the means of diagnosis, examinations, and also by MRI, then the surgery may be advocated. All right. The surgery is basically quite a straightforward surgery, whereby it is actually more of a keyhole surgery, which is called arthroscopic surgery, but depends on the condition, the diagnosis of the shoulder pain, whether it is a rotator cuff tear, whether there is a condition called impingement syndrome, whether there is an arthritis. So this can be treated by surgery, of course. Furthermore, all right, a lot of these problems in the shoulder are caused by small bony spurs in the joint, and these bony spurs can be eliminated by the means of surgery, meaning the shavings of the bony spurs, and of course there is some removal of these extra tissues which causes the pain and impingement on the shoulder. So this can be done through arthroscopic surgery. Yes, the tendon won't heal on its own. Once it's torn, there's a process of continuing progression of the tear of the tendon, and I tend to be aggressive in managing this situation, especially in the young and the active individuals, as this tendon tear or muscle tear can progress into a bigger or massive tear, and this will definitely cause more problems to the patient. We have come a long way. Typically, historically, and even in some surgeons' hands, these rotator cuff repairs are done in an open surgical method, meaning there's a large incision which is done on the shoulder to treat surgically the torn tendons. But nowadays we have the new technique called the arthroscopic surgery, where keyhole incisions are made in the shoulder, and special surgical instruments are passed through these incisions to repair the torn tendons, and also to perform other technical procedures such as shavings of the bone, and also cleaning up of the tissues inside the joint. And this is less painful as compared to an open shoulder surgery, and patients usually can recover faster, and they can also be rehabilitated quicker, and in turn that enables them to return to their normal activities much earlier. there are actually many great options to treat this problem, and fortunately it works very well with conservative treatment. So I would encourage these people to seek treatment for their problems, because to have something done about it, evaluated properly and treated well, and maybe at the level of GPs, general physicians itself, and basically hopefully the problems of the shoulder pain does not progress to much worse level. Patients should not brush off the pain of the shoulder lightly. We must recognize that this pain could be due to more worse problems than the normal muscle pain. And people, especially the elderly, should not be involved in any overhead activities or lifting heavy loads, especially if they are not used to doing it before. Finally, people are actually advised to perform warm-ups or stretches if you are planning to do any overhead sports, such as badminton, tennis, or in fact playing volleyball.